With that said, everybody, thank you for joining today. I really appreciate you all taking the time to join. To open or not to open, that is the question. Here we are, all facing down something new or something that we have been planning and stressing about for weeks, and the uncertainty is getting the better of us. And I want to walk through a couple things today that'll help us maybe unmystify and unfog the future, get a little clarity around facility reopening. We're going to tackle some topics like the science of coronavirus. We're going to talk through some of the latest and most up-to-date things, rehammer home some points that maybe you're already familiar with. We're going to get into some of the tactical aspects of reopening facilities. We're going to talk about how to deal with the uncertainty and some tools and techniques that you can use to help you deal with uncertainty. And then we're going to talk about the people aspect of this. And my hope is that as we go through this conversation, you will engage in the chat. Like I said, the folks joining on this call today obviously have a deep interest in this topic. You've explored it from a variety of aspects. You've got questions, you've got concerns. Folks on this webinar probably have answers, or at least can help you down your path. And if not, I hope to be able to do the same. So I will do my best. So please pull up the chat, stay active there. And thank you so much for taking the time to join us. I know it is not always the easiest thing to do to take the time to be able to do that. So I really appreciate everybody taking the time to join us today. With that said, let's do this. All righty. And so here we are, to reopen or not to reopen. There is the question that we're trying to answer. And so with that said, I want to start off by saying that this webinar is being sponsored and brought to you by Cartograph. Cartograph has got space planning management solutions for you as well. So if you're looking to understand more about your facilities, definitely reach out to Cartograph and they can help you. And we've got some folks on the call who will be able to help you understand how they can help you with space planning and space management. So please, big thanks to Cartograph for bringing this topic forward so we could have a meaningful discussion. But let's start here, my friends. It's science. Let's start with science. I'm a believer in science. That's right. I am not part of the flat earth movement. I am a big believer in science's ability to deliver answers for us. And so I want to demystify, I want to clarify, I want to get into some of this stuff. Some of you may feel it's controversial. I feel it's science. So with that said, I'm going to go ahead and bring forward some facts here. These are just a little bit of the coronavirus statistics of the day. So here's where we are today. As of today, there are a total of 17.2 million cases of coronavirus, 671,000 deaths, 10.7 million recovered for an overall fatality rate of roughly 6%. So if we're talking about the death rate related to that, just so you know, that's the numbers, and that's where we are today. You'll notice the size of the blue dots correspond to the number of cases. You'll notice that the United States, with 4.25% of the population, has 25% of the overall cases, which means, in a nutshell, we suck at this. So there it is in brass tacks, okay? So the size of the dots help you relate the number of cases that we're having around the world. So hopefully you can gain some perspective into how bad we as Americans are doing when it comes to dealing with coronavirus. You can pick whatever metric you'd like. I'm just keeping it real for y'all. You pick whatever metric you like, go out and do your own independent research, use something reputable like Johns Hopkins, and you can go ahead and find all the information you need related to where we actually are. So here's what we know about transmission at this point. And this comes from a variety of different data sources that I can cite. So first off, children ages 0 to 10 have a very low risk of spreading this disease. So that's just what they've discovered at this point, is that there's an incredibly low rate of infection and an incredibly low rate of transmission coming from children 0 to 10. Now, they don't know whether that's because kids literally can't cough high enough in order to get adults, whether it's that they have, that they lack the receptors that the coronavirus needs to attach to, but the evidence coming in from large studies, including one in South Korea, one in Germany, and information here in the United States, show that ages 0 to 10 have an incredibly low risk of spread. Our risk of spread from surfaces, people have been concerned about touching packages, touching doorknobs, those kinds of things. It is a low risk of spread with proper, and here is the asterisk on that, with proper cleaning protocols. It is an incredibly low risk of spread. Copper, it lasts up to 4 hours, cardboard up to 24 hours, and plastic and stainless steel up to 2 to 3 days. Again, those times change depending on heat, humidity, and sunlight. all of those can have an effect on the amount of time that the virus remains viable on surfaces. So there's your science behind that one. Let's talk about some terms. Pre-symptomatic and asymptomatic spread. Pre-symptomatic means you're spreading the virus before you know you have it, and asymptomatic means you're a carrier of the virus, can infect others, but don't know that you have it, which means by the very definition, people are incapable of knowing whether they have the coronavirus. It is not possible for somebody to tell based on how they feel that they have it. Asymptomatic carriers exist. They are very real. And so when somebody says, I feel fine, that doesn't mean that you're not a carrier, which is one of the very tricky parts about this disease that is difficult because people don't always show symptoms or are capable of spreading it far before they do show symptoms. So let's just get this stuff out of the way. We have to be careful of that. But just so you know, how you feel means nothing when it comes to whether you actually have this or not, which is why when we deal with things surrounding science, it becomes something that you can't feel your way out of this one. Even if you're not sick, you can still spread it to others. The high risk of spread is coming from something called super spreaders. This seems to be a significant source of transmission. These tend to be symptomatic carriers who infect large populations. And so we've seen this, I think it was 2 days ago, there was a church in Georgia where over 65 people were contracted coronavirus because of singing in the church. And one symptomatic carrier ended up becoming a super spreader. We heard about meatpacking plants. There's been occasions with gyms in several different countries where gyms, one person has carried it into a Zumba class and has infected hundreds of people as a result of that. So the super spreader is a very significant source of spreading of the disease, and they tend to be symptomatic carriers, but again, wanted you to know about that particular type of spread. And airborne is the predominant way it spreads. Now, they don't know whether that necessarily means droplets or whether aerosols are the primary mode, but at the same time, both of them seem to have an incredibly high likelihood of spread. Again, with an asterisk on that, which is to say masks and social distancing can help prevent that spread. They have also recently changed the isolation guidelines. Now, the previous guidelines stated that you need to quarantine for 14 days. And what they're saying now is that that number should actually be 10. There has been very little to almost no transmission beyond the 10-day period. And so while the guideline was originally 14 days, know that that has been shrunk down to 10 days by the CDC and the WHO. So just be aware that that isolation guideline has changed as well. So when it comes to this, let's talk about masks for a second, because we got political and weird about it here in America. So I just want to go ahead and throw out a few signs. This is my take at having a little fun with it because it's gotten so weird. But, you know, the fact of the matter is I love it. No mask, no service, grow up carried. I think when masks get tied to your ability to get tacos, we have now stumbled upon the best currency that we could possibly have to get people to take masks seriously. So just having a little fun with it. But the fact of the matter is masks work. Not all masks are created equal though, right? Valve masks are not something we want to be using. They allow for the unfiltered transpiration of air during an exhale process. Those are not the type of masks we're talking about. But when we talk N95, cloth and surgical masks, we are talking about masks that have a great effect on being able to control it. So again, science needs time in order to figure out the exact control of transmissibility, but leading scientists and epidemiologists are estimating 30 to 50% source control prevention. What that means is if you happen to be one of those people who has a cough, has corona, or doesn't have a cough, but has corona, if you're an asymptomatic person, the mask will prevent you from expelling droplets into the air and therefore potentially getting others sick. So it'll cut that risk in about half. If the other person is wearing a mask, they're saying somewhere in the neighborhood of 30% reduction on them breathing in. Now those numbers change regularly based on new information and new studies, but those are the rates that people who are modeling the disease are using and the best scientific information we have today about it. Modeling indicates if we were 95% of the population wore a mask, 18% fewer people would die from the coronavirus by October of this year. Goldman Sachs says that this is the way to keep the economy open and avoid losing 5% more of the GDP. So these are some things. And here is the spread rate of mask versus non-mask. As you can see, mask countries had a significantly lower rate of infection and spread than non-mask countries. So I think I beat that horse to death. If I haven't, it is part of the overall equation. But I also want to talk about this one of social distancing, and then we're going to move on. This is about overcoming and being outside of range of exhaled particles. Aerosols can travel further than 6 feet, but you need to have enough of the virus in them in order to get somebody sick. So after 6 feet, that risk substantially decreases there. And this is how nature does it, by the way. Nature doesn't have the advantage of, when there is a disease spreading through a population, of creating a vaccine to control it. But what nature does is it uses social distancing. This is how nature handles when there's massive infections. Lobsters use social isolation methods for the sick. Mandrills will not groom. People who they can smell through their urine have actual sickness. Garden ants, they can be infected by this fungus, this really crazy fungus that can kill them. They are isolated as well from the rest so that they can't spread it. And house finches are the same way. All of these use social distancing when facing this. So social distancing is not only effective for us as humans, but it's also nature's choice for dealing with a pandemic like what we are. And here are lessons from the other country. Like I said, America, we're not doing so well at it. We're not good at this. We got 25% of the world's cases and less than 5% of the world's population. So here's what other countries are doing and the lessons that they've learned. In many cases, these are from specifically from opening up schools. So just want to address that this is predominantly from schools. So in South Korea, they found, they did significant large-scale studies that found that children under the age of 10 are not good transmitters. So again, really significant study there. Denmark and Norway opened up their schools. They did basically all of the best practices. They used social distancing, they boosted their cleaning regimens, they limited class sizes, and they used cohorts to minimize interactions during recesses, and saw no substantial increase in cases. So through proper sort of management with best management practices that we know today, they were able to do that. Israel went the other way. They opened with no masks, had rooms with over 40 people in it, no distancing, and they saw massive outbreaks where thousands of people were infected, and they reclosed down all their schools. So when you consider it, you know, two polar opposites. Germany also following best practices, no sporting events, masks, no student outbreaks, and now Germany is at the phase where they are actually reopening up sporting events across the country because they're not seeing that spread happen, and they're able to control it through the proper social distancing, through masks and other techniques. New Zealand completely eliminated its caseload. They did that by maintaining full lockdown, and were able to get there. So my point being is that yes, other countries have found and learned lessons to control the spread, and we can too. They are not geniuses outside of the space that they're following practices that can help educate us to do the same. So just know that we can do it. In every case that they were successful, masks and social distancing were key factors for success. Okay, so when it comes to schools, just be mindful that this is some of the lessons learned from that. Also, so we're done with the science. Hopefully I beat the drum for a little bit on that, because it's the basis for how we look at dealing with uncertainty. So the science informs us of what we know and what we don't know, which is incredibly powerful when it comes to dealing with uncertainty. Please do not use anecdata. I feel like it looks this way, or it should look this way. That stuff gets you into trouble. As somebody who either works with Cartograph, or if you've worked with, you know, any sort of data-driven decision-making tool, you know that collecting the data and allowing it to drive your decision-making is a right way to go about it. So let's talk about dealing with the uncertainty for a second here. First of all, here are some of the factors we deal with when we deal with uncertainty. We're dealing with fear of the unknown, which is predominantly what we deal with, but in this case, we're also dealing with fear of the known. There are some scary statistics out there. This is an incredibly dangerous, you know, this is a dangerous bug we're talking about here, you know. Part of uncertainty is knowing to control what you can and know what you can't control. And that's where science comes into a large degree. When I deal with people on the sustainability side of the house, when I deal with them related to innovation and approaching innovation and working through the uncertainty that's created as a result of that, it's about knowing what you know and knowing what you don't know. And that allows you to make the intelligent decisions. What's the data that we know? What's the data that we need to know and that we don't know yet? So use science and data to demystify this. Feel free to read the studies. Don't just read the article headline, okay? And here's the other thing. We are months into this now, and the uncertainty is really hurting our people. I don't know whether it's you personally experiencing this. If you are, feel free to sound off in the chat. I'm gonna say this though, a lot of folks that I speak with are really tired of dealing with the uncertainty. It is just wearing on them. It's wearing on their soul. This is not easy work that we're doing here. So recognize that there's a huge psychological and human toll at play here. that we're all dealing with. And so also in that space, please remember to offer counseling and deep empathy as a leader to those around you. Your experience during this coronavirus lockdown or whatever is different than the person next to you. And everybody's having radically different experiences. So just know that take the uncertainty of the coronavirus experience on a personal level and then add in the uncertainty about whether to reopen a facility or whether to not reopen a facility. I would bet you that probably half of the folks on the call today have had guidance change on them in the last week. Am I right? Somewhere along the way in the last week, the guidance changed on you, and now all of a sudden you're having to course correct and shift again. So there is an emotional toll because humans, we don't do well with change. We don't do well with uncertainty. Psychologically speaking, it's just true. So we've got to learn to get better at this. And a lot of people are really just fearing the consequence of the decision that they might make. We've got to make some tough choices because there are no easy answers here. So as we make tough choices, I want you to know, you're not alone. It's okay to have the courage of your convictions and make sure that if you're using science to inform this, you make the best decision that you can from a data-driven perspective and move forward. Document those, learn, and get better, okay? Because we don't know all the answers, nor will we. Here's one of my favorite techniques. Now I'm gonna oversimplify the heck out of this in order to try and convey it to you, but this is a thing called decision tree analysis. And so I want to explain how this can help demystify uncertainty for you, okay? So here is a very simple version of decision tree analysis. What we do is we take a look at a starting point in time. That represents the target that you see on the screen there. And then we have options for opening school. So in this case, I'm thinking either K through 12 or whether a higher ed institution. And so as I think about that, what are the options? We can open or we can not open. If we open, the question becomes, what kind of capacity will we go back to? Classroom capacity. We'll go to 100% classroom capacity, 75%, 50%, 25%. You can pick options that make sense for you, your community, your organization, okay? Not open, there are two options. We could close entirely, no school, or we could do remote learning. What we do there is after we come up with the decision paths that we need, we start to demystify what does it look like? What do you think the odds of us opening versus not opening look like? So with that said, I just want to ask a quick poll. We're going to go ahead and pull this up and I'm going to launch it. Just curious, will schools reopen on time this fall? Your best guess, your opinion. What is it you think? This is one of my favorite parts about a webinar is the part where I get to see the results come in live as everybody starts to answer the questions and you're still on the edge of your seat trying to wait to find out what happens. It's fantastic. All right, we'll give it another 5-10 seconds here. If you haven't, please take a vote. All right, and shutting it down. We're gonna end the polling here and share the results with you. So here's what you think. You think opening is gonna be delayed. So it sounds like maybe we're in this in the space of yes, it'll be opening, yes, it'll be delayed. Right behind that though is no, online only. So even on this call, we have some uncertainty. 6% say they're not sure and 6% say full steam ahead. We are opening and we're opening on time. I know that this is not the discrete number of options that exist in the universe for how things might proceed, but just to give you a sense of the uncertainty and the differences around the country that we're all facing, you can see from these answers that we're all approaching this from a very different mindset, and we need to be. Okay, so this is a good thing. But it also says you're not alone in dealing with the uncertainty. There's a lot of folks dealing with that same uncertainty. So thank you for your input on that. So as you can see, we might have no opening delayed, 52% might be how it looks. So as we get back to this decision tree analysis, what we do after that is we assign percentages to the likelihood that we think of these outcomes. So for example, if we thought that the schools are 70% likely to open and therefore 30% likely to not open, let's just say that's what we decided. You can change those numbers based on your community. You can use polls amongst people in your community to help arrive at those numbers, just like we just did, okay? Then we start to look at capacity. Let's say you think that if we open, there's a 20% shot we'll reopen at 100% capacity, 30% shot that we'll reopen at 75% capacity, and so on and so forth. You'll notice, by the way, that the total for 100%, 75%, 50%, 25% capacity is 100%. You'll also notice that closed entirely and remote learning's sum total is 100%, because that is the odds of activities inside of not opening. So we assign percentages to each step in this process, and then we multiply. What that allows us to do, so for example, you'll see here, if we reopen at 75% capacity, there's a 21% likelihood that we feel that that's the likely outcome. Okay? You'll notice that the number one most likely outcome, according to this decision tree analysis that we put together, is that not opening and remote learning is number one on the list at 28.5%. Number two on the list is opening at 50%, and number three on the list is opening at 75%. This is a very simple model to be able to start to focus your efforts, because now we prioritize 1, 2, and 3. And we start to plan events around 1, 2, and 3 only, which means that we get rid of 20% of things roughly that are not high likelihood outcomes, or things that we feel are not high likelihood outcomes. So this will allow you to focus your activities based on things that are the highest likelihood outcomes. I also find that people tend to make this complicated. I think simple is a better guidepost, because then it gets into the planning and the rubber meets the road part of this, okay? But if you're looking to demystify and at least get some sense of where you should be putting your planning efforts, consider this as a tool, decision tree analysis. Reminder, everybody will get a copy of a link to the presentation, a link to the slides, all that. So copy and take whatever notes you need to in addition. Another technique we can use are things that I call plan ahead teams. So the point of a plan ahead team is you have a team currently actively working on COVID. They're dealing with the day-to-day events that happen with COVID and whatever your organization is. I feel confident most organizations have that at this point. So you've got a group of leaders who are getting together and talking about what it is we're needing to do to address it. What you may not have is a team of people whose job it is to sift and look into the future, intentionally look into the future. So that's a small team of people that are looking to plan along different time horizons. The ideal size is somewhere between 4 to 8 people. You need them to be nimble, potentially, not potentially, but preferentially, we want them to be from different departments, okay? Varying background, varying functions to get that team together. The goal is to identify trends and possible outcomes in the future and just sort of give ourselves a sense of where we think things are going. We should plan for different scenarios. What if things go well? What if things go about like they're going? What if things go poorly? That way we have different event horizons. Now that can mean a variety of different things depending on the type of organization you're in, but define what good, medium, and bad look like, and then start talking about those horizons as you look at a 2-week horizon, a 2-month horizon, and a 2-year horizon. So your team should actively be looking at good, medium, bad scenarios under a 2-week, 2-month, and 2-year scenario. So in effect, you end up having 9 different boxes of planning that you're doing. The things that seem to be common in all the boxes allow us to point in a certain direction to those who are dealing with the day-to-day implementation of COVID activities. So the goal of this team is strictly to help us look and plan into the future. The goal should be to meet weekly or bi-monthly, twice a month, and document assumptions and data. So this is another one of those things. As you make decisions, document the decisions, document the assumptions, and the data that you use to make that decision. That way, if you get called into question, you can go back and refer to the assumptions at the time that led you down that path. Okay, plan ahead teams are a great way to build in some forward-leaning, forward-thinking into your organization, K through 12, higher ed, cities, counties, it doesn't matter. Plan ahead teams are a great way to do that. If you'd like to learn more about plan ahead teams, feel free to contact me and we could chat about that. Facilities. So we just dealt with the unknown, right? We've got to deal with that human aspect. We've got to deal with some tools like decision tree analysis, look ahead teams. Now let's talk about facilities for a second. I want to take a pause here for a second. If anybody has suggestions about how they're dealing with the unknown, would you do me a favor and please leave it in the chat? we're going to make sure and make the chat available to everybody. So as you have ideas or things that resonate with you, please include them in the chat. They'll be documented for everybody then, and we can use that as a great exchange moment. Let's talk about specifically what needs to happen with our facilities now. So this is going to get tactical. We talked about a little bit of the strategy. We talked about the science. Now let's get into some of the tactics of our actual facilities themselves. Now facilities vary a great deal, as do the folks on this call, right? So when we think about this, there's a lot of things to consider depending on the type of facility. But again, want to get very tactical with this. First of all, when we talk about planning, planning is a huge part of dealing with the layout, with the spacing, with the overall cleaning, everything related to the reopening. And I just want to reemphasize that Cartograph has space planning and management tools, which very likely can be paid for with CARES funding in your community. So I just want to put that out there. You could probably use CARES funding to be able to get this space planning and management tools if you don't already have something like that. And if you're curious, please reach out. Cartograph would be happy, I'm sure, to show you what they can do in helping you get there. But whatever your tool is, start your planning process and start doing it virtually if you haven't already. I imagine most of us are there. But when it comes to it, you can physically design a room on a computer, but you got to go into the room and physically lay it out. This is where the rubber meets the road. You got to go into the room and notice the things that you never noticed, the odd pipe in the corner, the ceiling, the configuration issues, the glare, all of that kind of stuff has to happen with boots on the ground, you in the room, rearranging the furniture. So physically move the room layouts in order to observe flow of traffic, in order to observe how people would be breathing, how lighting would work, those kinds of things. I can't stress that enough. I've definitely heard of 1 or 2 cases of people who were planning, but didn't go in and actually physically move the stuff, and now they're having to rework everything. Okay, so real tool, real opportunity there. Some of the other things is you need to make some conscious decisions, and these are hard decisions at times. How are you going to use or not things like kitchens and conference rooms? Are you going to block them off entirely? Are we going to have heightened cleaning protocols? What about gymnasiums? Will they be used, or can they be used to go ahead and do classes in a more open air environment? Or, so consider specifically how you're going to handle those things. For my government customers out here, the same thing runs true when it comes to your rec centers, right? When it comes to your aquatics facilities and those sorts of things. This is completely relevant in that space. What is it you're going to allow the public to have access to? What aren't you going to allow them to have access to because the risk is just too great, okay? Also, spacing layout considerations. Consider extending the viability of outdoor spaces with things like tents and heating. The fact of the matter is airborne transmission seems to be the highest likelihood of transmissibility. We need to deal with that. Open air and outdoor seating environments are vastly preferred to indoor ones. That's just the truth of it. So when you think about it, is it possible for you to extend the season? The University of Eckerd in Florida is actually moving to an almost entirely outdoor class schedule over the course of the next few months. They identified areas in their quad and on their campus that could allow for significant social distancing, had access to Wi-Fi, and could potentially be locations for people to do outdoor classes, and that's what they're proceeding with. And so people have had a chance to weigh in, and Eckerd's going to go to an outdoor class. Now, of course, they're in Florida. Some of us in the Midwest are, dealing with that, and without the fabulous weather of Florida to work on our team, certainly not the challenge that we've got. We've got a different one. But is it possible to use other techniques to get outdoors? Even if it just means your meeting spaces. Can you find a way to start meeting outdoors and create socially safe outdoor meeting spaces that meet guidelines, okay? Consider your nursing stations. Where should they be at? What should happen if we've got an incident? How does that affect the rest of the flow of the facility itself? And cleaning station locations. If you haven't gotten all your cleaning station information, you're probably struggling to do so, but please consider how frequently we want or where we want those cleaning stations at amongst corridors, hallways, classrooms. And shut down water stations. It's a good chance for you to shut down your water fountains and start to replace them with bottle filling stations. But I would just be very careful as you look at this to, please shut down your water fountains and replace them with something else that could be cleaned easier and won't carry the coronavirus. Okay. Air handling. Again, air is one of the absolute keys to our success with reopening facilities. So let's talk about this here. And again, I'm going to get into the weeds because we have some facility folks that need to know this on the call today, all right? So first of all, let's make sure we conduct our HVAC, which is heating and ventilation rate readiness testing. Does it work like it says it's working on your controls? And test and balance to ensure smooth operations. We need to make sure that we're doing both of those before schools begin, before your facilities reopen, to make sure that when you're managing it remotely, the thing that's happening in the physical school is what's actually happening on your controls panel, okay? ASHRAE recommends replacing all filters before the beginning of the school year. So if you are reopening a facility for the first time since it's been predominantly locked down, ASHRAE does recommend replacing all your filters. MERV 8, 11, 13 filters depending on intake or return. So just real quick on these are different particulate ratings for filters. The catch on this is that if you have a filter with a really small filtration rate and the air is coming in through it, it takes a lot more energy to push that air through a filter. So as you have tighter and tighter filters, you're going to cause your equipment to work harder and harder and increase your energy costs as a result of that. So make sure that you're using the correct size filter. We know that we don't want air recirculating in our facilities. And so we want to make sure that, do we need to put a lot of filtration on the effort going in or on the effort coming out? Be mindful, and every facility is different, but seriously consider what filtration level you're using. And there's a balance to be struck there in that space. And disable your demand control ventilation. Some of you may have that enabled, but please disable that for the foreseeable future, because again, the exchange rate of air is so critically important for us, and we can't have that closed off without our knowledge, right? Here's some other things. Close your your return air dampers and open up outside air as much as possible. So in this case, a specific example, doubling the damper settings or 40%, whichever is less. Your situation will be different because we're dealing with so many geographies in the United States with different heating days and cooling days. Just be mindful that this is the one being used in Colorado by Denver school districts. They're doubling their damper settings or 40%, whichever is less. But that's what they decided in an attempt to prevent freezing of the coils and those kinds of things. So be mindful as you do it. Think about what those damper settings should look like, but as much outside air as possible is where we should be living at. Relative humidity guidelines are shooting between 40 and 60%. That allows it to attach and pull the coronavirus down, which allows our maintenance and our janitorial staffs to clean it off of a surface. So that is important. The relative humidity is between 40 and 60%. What they're recommending is that you purge air 2 hours before and or after school and before opening. So 2 hours before opening up school, 2 hours after closing school. In reality, I don't think it's necessary to do it after school. And the reason being is because it allows those particulates to settle. Your janitorial staff can come in later and clean those surfaces and the particulates will have settled. Then you ventilate the air either late at night or right before the school reopens, and that allows for fresh, clean air to be in there. But again, that air exchange is so critical. And consider portable HEPA filters for your classrooms. Maybe that's the right call for you, maybe it's not. Or UVGI lighting, which is a UVC light designed to attack germs and be so powerful that it destroys viruses. There is not enough data to prove that either one of these work or don't work, but the information is encouraging. Just know studies that demonstrate their viability on a scale that I think we can make a recommendation on, but just know that the results are positive, not definitive. And run exhaust fans in all restrooms 24/7. Kind of feel like we should have been doing this the whole time, but whatever. And maintain negative pressure in restrooms, okay? Open doors to all janitorial and storage closets. Anything that doesn't have its own ventilation, open those doors at night when the building's not occupied in order to make sure you don't accidentally create a little super zone of coronavirus hotbed of activity, okay? Again, that air filtration allows for the facility to clean itself every single day. Cleaning guidelines, CDC has been very clear about what those guidelines look like. That's the link. Again, you'll get a copy to that at the end of the presentation. And as I said, waiting for the air to settle and not immediately cleaning schools or facilities after their use is a great way to allow the particulates to settle, minimize the risk to your janitorial staff, allow you to meet CDC guidelines, and hopefully pick up more of any existing virus that might exist and get it out the door. And just remember to increase the cleaning frequency for any high traffic areas. So if you do have high traffic areas, make sure you increase the frequency of cleaning those areas. And last but not least is storage. It may not be top of our mind, but again, with facility planning tools, space management planning tools like Cartograph offers, these are the types of things we should be looking at, right? How much storage do you need? If you're going to reduce the capacity of your classrooms to 50% of their current level, you got to do something with that furniture. I'm sure you're already struggling with that. So here we are, commercial rent is going up for these kinds of spaces, right? Storage spaces. How much storage will you need to store all the stuff? Then the follow-up question becomes, does it need to be temperature controlled or humidity controlled or not? In certain southern climates, having something that's not temperature controlled might severely injure some of the equipment that you're moving out of it. Do you know your assets? Do you have labels or things that track your assets so that when you're putting them into a facility, you know you can get them out of the facility and know where they're at? So if you haven't dealt with that asset tracking, be mindful of how you intend to deal with that as well, because that's a substantial amount of money and community assets being stored in a location. And then the other thing is, what about your supplies of PPE, sanitizer, other cleaning supplies? So as you look at your storage, how are you creating storage and how are you stockpiling the resources you need in order to have your facility open? Because let's face it, you run out of masks at the wrong time, you run out of sanitizer, you run out of the wrong cleaning supplies, and all of a sudden your facility shuts down again. So how are you stockpiling the PPE you need in order to remain operational over an extended period of time? And commingling of assets. I've heard of several organizations banding together to go find storage space. But again, if you don't know what your assets are, and they don't know what their assets are, and it all gets put in the same warehouse, how do you intend to make sure that your assets don't find a way out the door when it's time to put them back together again? Just some things to consider as you look at reopening your facilities, and that's a lot to consider. So those are just some of the things that we need to take a look at. So a few things to think about. Can you move classes outside? Can you identify safer spaces to operate in? Notre Dame has even looked at using the stadium as a mechanism to go ahead and operate because it's got great access to Wi-Fi and it's open air. Now, seasonally, that's going to get a little tough, but people in Indiana are pretty tough. How can you maintain a personal connection? Again, there's this psychological damage that's being done to each and every one of us because of that lack of personal or interpersonal connection. And how will you deal with vaccinations? Once we get into vaccinations, it becomes an entirely new game. Will you only allow people in your facilities that have proof of vaccination? What about people who are anti-vaxxers and have no intentions of getting vaccinated? How do you intend to deal with them? Is it something that you have to have a card to be able to re-enter the facility? It's going to take a while for the vaccinations to happen across the country. So even if vaccinations start, it will be a time period before we get into herd immunity. Or are able to distribute that. And again, what's the equity of the distribution model that we'll be using? How will low income and disadvantaged populations be able to get access to that? So we have a lot in play once the vaccination part of this comes together. And again, that is a huge factor for the timelines for safe reopening. And again, how can you right now consider identifying populations of students or teachers or employees and citizens who will return and won't return? It is entirely likely that some of the folks who operate our facilities, they may be older, they have great knowledge, they know, you know the guy, you know Bob, and Bob knows everything about this facility. He knows every single bolt that went into this facility. But he's also retirement age and now has zero interest in coming back to work in an environment where he might get sick. How are you going to deal with that knowledge loss, or what are you going to do to ensure knowledge transfer? Again, what about marginalized populations? What about those who are predisposed to health conditions? I have a heart condition. My odds of dying if I catch coronavirus are significantly higher than the rest of those in my age population. That's just how it is for me. So for me, this is a more deadly disease than it is for many others. Again, I'm in my mid-40s. If I was in my 60s, I certainly would have no interest in coming back to that environment. So how many of your teachers, how many of your employees, how many of your workers are actually going to return? This issue of population is a huge one. and not easy to determine how it's going to shake out. You just need to do the best you can, making some assumptions about it, but start looking at-risk factors in your population of both your employees and either your citizens, your community, or students, and look for those other risk factors, okay? But again, students, you know, my political beliefs might prevent me from going to school, or some of those types of things, or I may feel that it's unsafe because of my condition to send my child to school. Those are all considerations that we've got to be mindful of. So think about your population of employees, how many will return, whether knowledge transfer is possible, and then the population of citizens or customers or students that you might be able to serve as a result of that. And last but not least, let's talk about the people, because there's a few more factors that go into this uncertainty related to reopening, and that's the human factor. One is childcare. This is an incredibly practical issue for those people with children, but at the same time, what are you going to do when you're working remotely? We've had some taste of this, but at the same time, working remotely with a toddler here and trying to teach classes or trying to interact with a citizen online, that's incredibly difficult if childcare is not functioning. And again, what we know is 0 to 10, incredibly low rate of transmission. They have had one death in Canada, one, out of anybody under the age of 10. That's it. The numbers are similar in the United States as well, despite the ballooning number of coronavirus cases. I believe it was 15 total deaths under the age of 10 from the coronavirus, I think. Again, lots of numbers swirling around my brains, but I'm close on that. Again, personal health concerns. What about your personal health may make you decide or not decide to go back to work? A lot of factors inside of this, right? And then again, special education. What about those or marginalized populations? I have been very vociferous. I've been incredibly loud about the difficulty that masks and mask wearing are placing on our deaf population or our hearing impaired population. The masks are incredibly difficult for them to learn because they can't read lips. How are you dealing with special education? How are you dealing with marginalized population? And all of the socialization information points to in-person education is substantially important, especially for those populations. I don't know what that means and how we deal with it necessarily, but at the same time, recognize or come up with a plan on how to deal with those populations the best you can. And fatigue. You know, I've been saying that this is a pandemic, not a productivity contest. And I really want people to remember this. You know, I know you're doing the best you can. I know those around you are doing the best you can, but we're all struggling on a social level in some way at this point. And so recognize that we've got a lot of fatigue. Zoom fatigue is a real thing. So I'm sure some of you are experiencing that right now as well, but it's a very real thing. So we're dealing with human conditions that we never have. And some people are rising to the occasion and others are just going straight crazy. And that's okay. But we've got to know that fatigue is going to be an issue as we get into more months of this. And then the last but not least is access and equity. How are we going to deal with the access issues and the equity issues that are created by virtue of disconnected or marginalized populations in our society, right? When we have low income that's required to ride a bus to get to school, but now all of a sudden we have to run more bus routes in order to maintain social distancing. What does that entail for us? What is encompassed in that? Are we now running multiple bus cycles through this? What's the increased expense as a result of that? What about other complicating factors like internet access, right? Internet access is huge. We'd love to do remote learning. Sorry, you don't have internet access because you can't afford it. By the way, we can't let you go to a library because there's too many people there because we need to socially distance. We can't allow more people in there, so you can't even get access to the free Wi-Fi. How are you going to get internet access out to your community so that they can engage in learning? If we expect for things to work remotely, this has got to be number one on your list, is how to make internet access possible. Is it possible for a higher education institution or a K through 12 to partner with a local park system and identify parks near disadvantaged areas and potentially help them hold outdoor classes, create Wi-Fi hotspots, and create the opportunities for that to happen? And I just want to share a quick story about something that I heard out of Tennessee that I really love, Shelby County, Tennessee. They do a thing called Code Crew TV there. Now, Code Crew had been operating for 5 years, and what they did is they teach coding skills to disadvantaged school children. So they take them out in high school, and they bring them into the libraries, and they were teaching them how to code. So these disadvantaged kids would go there, learn how to code, develop real life skills, and by the time they entered college, they had programming skills that most adults don't even have. So a really excellent way to sort of start to bridge that gap. Now what happens when all of a sudden you can't go to the libraries anymore? Well, what they did was they said, we're not giving up. They found a way to partner with their local government and offered local access, cable access television. Every Friday, they would hold from 9 to 10 or 9 to 11, they would hold Code Crew TV Fridays, where they would teach you how to code on television and then allow you to go ahead and do that work with offline courses and offline work. They would allow you to do that with the computer that they gave you at your home. So they found a way to continue that using TV as a great equalizer in that equation because they couldn't solve the internet connectivity issue. So just to consider, right? Internet access, other complicating factors, and what are you going to do about lunches? Especially if you're dealing with schools, how are you dealing with lunches? All of these human factors, all of these population variability factors impact your revenues as well as your expenses. And so it's really hard, and I'm sure some of you are being asked to forecast things that it's just not possible to forecast at this point. We've got to make some tough decisions. And so use decision tree analysis to start to winnow down and narrow your field of focus to likely outcomes. Use your plan ahead teams or your look ahead teams to start to look at those outcomes along different time horizons and start to find where are the patterns that you can begin to address right now. These access equity, these human issues, these facility issues, these uncertainty issues, I know it's a lot, and we've all got to work together on this, but there's such a panacea of difficult information here that we need to work through. So just start taking it one bite at a time, because that's how you eat an elephant, right? One bite at a time. And I mentioned CARES funding. It's a little off topic, but it's important here. And I want you to know why you might be eligible to use CARES funding. Here's what CARES funding, this is what the guidance says. This is straight up what the guidance says. Necessary expenditures for COVID-19 defined as reasonably necessary for intended use in the judgment of the government officials responsible. So whoever is the agency or official that is responsible, they make a determination on whether something's reasonable. If they think it's reasonable, it's good. Anything that was not included in the most recent budget as of March 27th, 2020. That would obviously be the case if you didn't have space management or planning management tools for that. That's the case. And was incurred March 1st to December 30th, 2020. So again, those are the guidelines. Easy enough to hit those targets. And here are examples specifically called out in the language provided by the feds related to examples of things that are allowable expenses under CARES. Disinfection of public areas and facilities, things for communication enforcement of public health orders, expenses to facilitate distance learning, or improve telework capabilities for public employees. That's all of this stuff. So I would say that if you don't have a tool to help you do your space management planning, you can very likely use CARES funding to be able to do that. And we'd be happy to talk to you about that. Here are some great resources if you're looking for it, some information on super spreaders. I like Colorado Schools reopening guidance. It's very clear, concise, and they update it regularly. So I know your community has probably got its own, but if your state lacks clear opening guidance, take a look at this as a best practice. I think it's really useful. Information about how the spreads, the surface information that I quoted, teaching outside at Eckerd, the story of how Eckerd is moving things outside and facilitating outdoor college learning, which is really excellent, and mortality rates and things like that per capita that can help us get there. And so that's the stuff that I wanted to share with you. And now what I'd ask is, what can you help us learn? What's your best advice on reopening facilities? I would love it if you would comment in the chat here, and I'm going to pull up the chat and just kind of see how we're coming along here. So we've got, okay, so our library is providing Wi-Fi access in the parking lot. That's a great solution. Let's see here. So rotating days, okay, another great suggestion, right? Rotating days, 3 days remote, 2 days in school, smaller class sizes and bigger rooms. And it's still changing, says Omar. Absolutely, it's changing, right? Second grade or higher is required to wear a mask. And also rotating student on school days to reduce class sizes. So that rotating concept, absolutely. Creating cohorts is the language that I've heard used, right? Yep, and again, humidity helps. Watch your energy costs. It's a tricky one. Let's see here. Make data-driven decisions. Don't rely on just your gut or outside pressure. That's called anecdata, Colleen. I can't stand that stuff. Offices are by appointment only, Virginia says. Love that, right? That's a very practical, reasonable way. I think the only thing is, how are you communicating that, right? How are we making sure that folks know that it's by appointment only? And I'd say anybody who goes out but doesn't check whether the place that they're going is open first, I've been surprised enough at this point. I'm sure you have too. Determine the difference between necessary business and optional business. I love this. Richard's got a great point here. Recognize that while many services can and should go online, you must address the digital divides and the civil rights implications. 100%, Richard, you're nailing it right there. And again, this issue of equity as we go through this process, it's already being shown in infection rates, it's already being shown in death rates. But again, the other part is, how are the vaccines going to be administered? How are we dealing with access issues to marginalized populations, to low and moderate income folks right now? What are we doing with that? Really appreciate that. And Matt says, I agree with Colleen. I unfortunately work with too many people who make decisions without good data. Yep, that's why I started with science today. I understand that science has been politicized, and I don't have any thought related to that I can share with you without being too political, but I will say that science and the best information we have are the best weapon that we've got in controlling this, which we know from other countries, it can be contained by proper behaviors, and especially in those where mask wearing is socially acceptable, right? Where, when they've already had masks, everybody had masks in Asia because they needed to cover their face to prevent against the poor air quality. It was not socially unacceptable for them. How can we build in social acceptance into mask wearing, considering it's such an important part of this? In Philly, the school system provided $150,000 loaner laptops for the school and discounted high-speed internet with Verizon and Comcast. Work together with your local telecom high-speed providers to provide to the most vulnerable students. That is great, Richard. What a great one. Carol asks, can we get a copy of this slide or all slides? Absolutely, Carol. Definitely going to get copies of slides out to everybody. That'll be published to anybody who signed up and registered for this webinar. Want to make sure everybody's got access. So love that. And my background is neither Zion's or Bryce. As a matter of fact, it is Sedona. That's where it's at here. Social media and signs outside. So again, I think you can't over communicate on this, your expectations. I really like simple signage and helping people do that. And as you're looking through this, remember, not only to have reopening criteria, which I was going through a lot of community reopening plans, and they were all missing one critical ingredient. When do we shut down again? And so this is the same thing. What are the trigger points for reopening and shutting down? If you can agree on what those look like, it's going to clarify a lot of how you're going to behave. But because a lot of people don't include that into their reopening or their closing plans, you're getting what you're getting right now, which is to say a lot of confusion. Everybody changes day to day and that kind of thing. So please be careful about that. And let's see here. As the Department of Water, we're requiring all schools to flush their systems prior to opening. A lot of stagnant water sitting in pipes during the closure. Thank you for that comment. I really appreciate that. It reminds me of one other thing. Marcelino, one other thing that came up was dumping water in your P-traps. So for those out there that, if you got a P-trap, make sure you're dumping water in those. They're used to regular flow. And what's happening is they can dry out and sewer gases can escape back into your facilities. So again, just take the time to dump a cup of water down a P-trap, prevent those sewer gases from coming back. Let's see here. Is our biggest and most complicated issue. So that's what I've got for today. I just want to say, hold on a second here. We do have some instances where there is science versus science. So I guess our best judgment choose. So here's what I'd say, without being political about it, all of the stuff I sourced today was coming from what I would consider to be a reputable source. Johns Hopkins, I think, does a great job at presenting data in a very non-politicized, data-driven fashion. So if you're looking for information, I would ping things off of Johns Hopkins. EPA and CDC, WHO, there's some level of politicization there, but at the same time, I don't know that it's as much as people say. But read the studies. I read well over 400 pages over the course of the last week of the actual studies that led to the conclusions for some of the things I'm discussing with you today. So I didn't just read the articles, I read the studies, I read the sources, because I think that's the way that we deal with science appropriately, so that we get out of as much science versus science as we can. But I know you don't have time for that. That's what you have me for, is to go ahead and put that together and synthesize that information for you here. So I really appreciate everybody bringing in their thoughts. With that said, I want to say thank you to Cartograph, who can help you with space planning management. On the Sustainavation side, I'm certainly happy to help any one of you out there when it comes to dealing with your uncertainty in your organization, or coach you through it personally if you're having some difficulties. This is a challenging space, and opening and reopening and closing the facilities is so much uncertainty. It's no wonder we're getting fatigue from it, okay? I just want everybody to know you are not alone in dealing with this uncertainty. You have resources in each other to be able to help each other out. So don't do this in a vacuum. One other thing I'd say is get together with organizations similar to yours in your region, and don't do one pilot and the same pilot in each one, but decide pilot programs you're going to do and partner regionally. For example, if one school wants to try out the effectiveness of UVC lighting, don't have every school try that out. Agree to report back to the larger group on that, and have every other school do a different pilot. Share the knowledge, because we are dealing with rapid iteration here. So that means we need to rapidly iterate ourselves, and we need to stay flexible in that space. So partner with other agencies in your region to try out new ideas and learn from each other. Don't make the mistake of replicating the pilot of the community right next to you. And again, Richard's offering. Thank you, Richard. Thank you for offering for that. Richard's put his information out there for you to be able to learn from what they're doing in Philadelphia. That's great. Sadaf, I appreciate that. Really, thank you for that. That's all I've got. Thank you for what it is you do to protect not only the communities, the citizens, your customers, your students, your employees. Thank you for being the people on the front line doing the hard work. I value and honor what it is you do, and I really appreciate it. On behalf of Cartograph and everybody who joined on the call today, thank you for that. That's what we've got. That's our time for today, and I wish everybody the best. Thanks, everybody.